comes to recovery from addiction, there are many options available. Meghan Graves joins us today to talk about the different types of treatments out there and how to determine which approach might be most effective for an individual. Meghan, first of all, I'm really glad that you were willing to come out and talk and share some of the resources that a lot of people don't even know we have right here in our county. We deal with this every day. We're working with people in crisis, trying to get them into treatment, but everybody else doesn't really know the valuable resources we have. Can you take a few minutes and just share some of the resources and where you work and what your role is?
Sure. So I work at Mountain Manor, or shall I say I work for Mountain Manor. It's an organization based here in Maryland. We actually have 15 sites throughout the state of Maryland, and several of them are right here in Carroll County. So just to start off with, the highest level of care would be Shoemaker Center, located in Sykesville, Maryland. That would be what people, what is known as detox. So people coming in there, it's considered inpatient treatment. It's a short-term stay. Most of the folks coming there are needing detox, a medical detox from whatever substance they're using, such as an opiate or alcohol or benzodiazepines, cocaine, you name it. So they get their detox, they receive individual and group counseling, and really probably the most important piece in my mind when someone comes to Shoemaker, our highest level of care, is continuing care planning, because they are there for such a short period of time. The other facility we have right in Sykesville is called Mountain Manor Sykesville. So that's essentially a step down from inpatient treatment like Shoemaker. So what's nice about Mountain Manor Sykesville is it's a longer term treatment program. So people are able to stay there for up to 6 months or so. And that's really intended for them to start building on their recovery and focusing solely on their recovery and, mending all of the things that occurred during their active addiction. We also have Westminster Outpatient, which is varying levels of outpatient treatment, and typically people enter that facility after they've either completed an inpatient or residential stay, or some people simply don't need to go and be detoxed or don't need residential treatment. That's the beauty of the continuum of care. Is a lot of people have this misbelief that I just need to go to rehab and my problems are solved, and that's just the furthest from the truth. That there's there's varying levels of care, and they're there for a reason. And it's a continuum, and sometimes have people, move along the continuum throughout their whole recovery process, and that's okay. That's what they're made for. The other one of our newer things that's been going on in the county for the last it's probably been about 2 years now, is we have Triage Beds located at Shoemaker Center, and they were really designed to fill the gap in services of immediate need for treatment services or intervention services. So what's nice about that is, say, Friday evening at 6 o'clock, and it always seems to happen like that. I know Tim knows, someone reaches out for help, or someone encounters someone that needs help. Typically, most treatment centers are, not accepting admissions at that time of day. So the Triage Beds, we're able to make a rapid intake process so that person can get into treatment or into that triage bed, which basically gives that person 10 days medical services as well as case management services, so that we can build a plan for what's going to happen next.
And that works where that can actually happen over the weekend.
Correct. So yeah, in fact, that's typically when we get our most referrals, because people, are either going to the hospital, or there's a peer out in the community that's assisting them, or a mobile crisis is helping them. And someone's ready and willing and they want treatment, or even if they're not ready and willing, honestly, even if it's like they have nowhere safe to go, they're not stable, they really need, a safe, supportive environment to go to, we have a pretty rapid process to get them in a safe place in a bed where they'll have 24-hour nursing care and assigned a case manager, and we can start building a plan. And again, the plan could be a number of things in those 10 days.
Yeah, that's awesome. The other thing we had talked about in a couple of the episodes is the in custody, like people coming from the detention center to treatment. Is that one of the options you guys have at both Shoemaker and the Mountain Manor?
Absolutely, yes. It's not uncommon for us to get individuals that are either considered detainee status or people that are participating in our our county drug court program, drug treatment court program, and it's really a great way for them to re-enter the community while still having support system in place, and for them to get the treatment that they need so that they can be successful long term. So yes, it's not unheard of for, it's pretty typical for us to get people that are coming from the early intervention program or drug court, or they might have been picked up for a warrant perhaps, and they're still in, they're actively using, and that's a really great opportunity to get them engaged in treatment.
Yeah, yeah. I've seen that numerous times.
Yeah.
If someone goes into the detention center 2 days prior to that, they're not ready for treatment, but then they go in, and I'm a firm believer that it doesn't matter how you get someone to treatment as long as you get them there, and then hopefully something will click, or at least a seed will be planted.
Yes.
One of the things that people don't understand is that there's different ways that people recover. It's the drugs have changed, the types of drugs, everything has just changed. The whole landscape of it has changed. So one of the things that I wanted to ask you is, there's a lot of talk about medically assisted treatment and different types of treatment. How does that work? Is it how do you figure out what's best for someone? I'm pretty sure it's probably an individual choice, but
absolutely. So it's a topic that I'm very passionate about, I'll be honest, and I think you know that already.
Yep.
But I really believe that there is no one size fits all approach when it comes to treatment options and long-term recovery options. So I personally believe and professionally believe that there's many pathways to recovery, and I know that at our programs we definitely help people along in whatever pathway they choose. So that can look very differently, for each person. Some people might choose to get on some kind of medication, relapse prevention medication, as I prefer to call it, to assist them with their opiate dependence or their alcohol dependence. And there's various types of medications out there. I know most people are more familiar with things such as methadone and Suboxone, but there's lots of other medications that can assist someone with their relapse prevention. And that all ties into their long-term recovery process. So yes, there's lots of options available, and I really think it works best when it's a mutual decision based on the individual's desires and what they feel will work for them, after also speaking with a clinician to kind of determine the best course of action.
Yeah. And it's one of the things I've evolved through the years in understanding, that there are different avenues toward recovery, and whatever we can do as a community, as the treatment providers like yourself, to get people engaged in something to get them away from the risky behavior that's leading to all these overdoses.
Absolutely.
Well, Meghan, I really appreciate you coming. I really appreciate you sharing and letting the community know what we actually have right here in our own community. And I know you're not just a 9-to-5 person for treatment. I know myself have personally texted you numerous times over the weekend and late nights, and you've always helped assist to get someone in treatment. So thank you for coming. Thank you
My
for
pleasure.
always being there.
Thank you.
Everyone's journey is different. Everyone's motivation is different. The key is to find what program works best for the individual. Work the program, and don't be discouraged if you stumble. Remember, it's only a setback, and you can start again.